Hello friends. Today I welcome all MSc students of Department of Applied Psychology from Kazi Nazrul University of West Bengal, India. Today is 20th January 2022. You all are invited for this class on mental retardation. Good evening all. I am Dr. S.K. Pandit, consultant neuropsychiatrist and head of the department of psychiatry at Central Hospital, Kalna. Today we will discuss few topics regarding World Health Organization codings of mental retardation, how we can understand those codings, what are the different codings used in different block of ICD10 International Classification of Disease and Disorder from the World Health Organization. Out of that, the F block we all know that belongs to mental and behavior disorder. So today the matter need to discuss regarding how to understand the codes of mental retardation from ICD-10 and what is mental retardation. So let's first understand the common coding that use for the mental retardation. F block belongs to mental and behavior disorder from ICD-10 and F70 code is used for mild mental retardation. Similarly, F71 is used for moderate mental retardation. F72 is used for severe mental retardation and F73 for the profound mental retardation. So we have four codings F70, 71, 72 and 73 as a common coding used for the mental retardation, respectively mild, moderate, severe and profound. Where F78 means other mental retardation and F79 means unspecified mental retardation. Sometimes fourth character may be used to specify the extent of associated behavior impairment. For example, if M70 F70.0 means mild mental retardation with no or minimum impairment of behavior, whereas F70.1 means significant impairment of behavior along with the moderate mental retardation, and that required attention or treatment. Similarly, F70.8 means mild mental retardation with other impairment of behaviors also present that needs attention and treatment thoroughly. So friends, this is the way we can decode F70 to F73 that is commonly used in the mental retardation. Now the most important thing to discuss is what is mental retardation. See, mental retardation is a condition of arrested or incomplete development of mind, which is especially characterized by impairment of skills, mainly manifested during developmental period, which contribute to the overall level of intelligence. We all know that intelligence means your cognitive power, language power, communication power, motor and social abilities. And retardation can occur with or without any other physical or mental disorder. However, mentally retarded individual can experience the full range of mental disorder, and the prevalence of other mental disorder is at least 3 or 4 times greater in this population than in the general population. In addition, mentally retarded individuals are at greater risk of exploitation and physical sexual abuse. Adaptive behavior is always impaired, but In protected social environment where the support is available, this impairment may not be at all obvious in subjects with mild mental retardation. So, when you see in depth about the mental retardation, they have three different kind of problems as overall. Communication ability is disturbed, independent self-care part is disturbed, and language development is sluggish. They achieve the ability to use speech for everyday purpose, to hold conversation, and to engage the clinical interview. Their this ability is little bit disturbed but still intact. Independence in self-care. Most of them also achieve the full independence in self-care, like eating, washing, dressing, bowel and bladder control, and in practical and domestic skill, even if the rate of development is considerably slower than the normal. And also, the mildly retarded people acquire language with some delay, but they can acquire. The main difficulties for the peoples of F70, children of F70 that belongs to mild mental retardation, are usually seen in academic school work, and many have particular problems in reading and writing. However, mildly retarded people can be greatly helped by education designed to develop their skill and compensate for their handicaps. Most of these in the higher range of mild mental retardation are potentially capable of work demanding practical rather than the academic abilities, including unskilled or semi skilled manual work. However, if there is also noticeable emotional and social immaturity, the consequences of handicap, that is, inability to cope with the demands of marriage, child rearing, or difficulty fitting in the cultural traditions and expectation, will be apparent among the children's those who detected with mild mental retardation. So, what is the diagnostic guideline for establishing a diagnosis of F70? Is if the proper standardized IQ tests are used, the range would be 50 to 69, and this range is indicative of mild retardation. Understanding and use of language tends to delay to a varying degree, and the executive speech or communication problem that interfere with the development of independence may persist in adulthood also. The main organic etiology behind the mild mental retardation is also identifiable in only few cases. We find associated conditions such as autism, other developmental disorder, epilepsy, conduct disorder, or physical disabilities are found in varying proportionate. If such disorders are present, they should be coded independently. And in addition to this, mild mental retardation. So these are the just about mild mental retardation, and today we have covered the coding of mental retardation, what is mental retardation, and something detail about the mild mental retardation with diagnostic guideline for diagnosis of mild mental retardation. And for the mild mental retardation, IQ range from 50 to 69 as per ICD 10 reference. Thank you, friends. We'll come with in the next video about the moderate mental retardation, the coding, the signs, symptoms, and the diagnostic guideline. Thank you.